Hi again, it's Granny Jenny. This time I'm not in my basement. This time I've decided to kind of come upstairs and I'm in my kitchen. Giving you kind of the latest here. Coming from Nowheresville, America, from my hillbilly state. This way I'm going to give you some information about Baby A. First of all, what you need to remember and tattoo on your brain is that Lucy, at her police interview, I don't know if it was before she was arrested or after she was arrested, basically said when they asked her about Baby A was hypoglycemic, meaning it was low on sugar. So just tattoo that on your brain. The information I'm going to give you here, again, it comes from a wonderful investigator by the name of Rosie, Rosey, Burton, Burton. Follow her on Facebook and Twitter. And this is kind of comes from her. So I'm just kind of trying to interpret it and give you kind of just my flavor as a nurse with 40 years experience. Not neonatal experience, adult medicine and surgical experience, but I did do chart audits and in the neonatal unit, so I understand the speak and how one is run. So basically, just some background information on what's kind of going on in the Countess of Chester right before Baby A showed up on the radar screen was that the Countess of Chester was undergoing a lot of rebuilding, rehashing. It's an older hospital in the 1970s, and again, that's perfectly acceptable. They're having to update like their A&E, their intensive care, their surgical suites. Apparently, I think maybe 2014, they actually started a bariatric program, an endoscopy program that's a GI, gastrointestinal issue with that. And I think they might have been trying to get what they call stroke certified. And if that is the case, what you have to do is you really have to have a certain amount of training, intensive care, A&E. It's a really involved process, but it's a really good feather in your cap if your hospital has that certification. What it looks like, they were pouring all their money and resources into the adult medicine and surgical areas of the hospital and just letting the women's and children's building just go to hell, which I don't understand. Now, apparently this started in 2013, knowing that this building is just so antiquated. It needed to be redone. They started what they call a baby grow appeal, started then. And apparently back then, it's when Lucy Letby shows up in the newspaper. They kind of had whoever was writing the newspaper article on this, tried as a fundraiser because they needed, I think they raised around 3 million or something like that, 3 million pounds or something like that to get this new building. They kind of did a little feature on her and kind of interviewed her, and sounds wonderful. So let's kind of go on. Basically, I think they reached their halfway mark in August of 2015. Now, remember, this is probably around the time that baby E died, ABCDE died. And that's when you see all those famous pictures, or infamous pictures, I don't know what you call them, of Lucy standing next to John Gibbs. There's a couple of nurses alongside her. And apparently there's the mother with baby Jacob that was there too. And they also did an article on baby Jacob, how it was a miracle baby, how it survived. And in reality, it was a baby that was around the time of A, B, and C that was in that first unit. It ended up getting at least 2 trips to Liverpool's Women's Hospital. First one being the poor extremities and its belly swelled up due to sepsis. It was extremely septic. Went to Liverpool's Women's Hospital, improved dramatically, then came back. And then it ended up getting abscesses all over its body, on its skin, and addition into a bone infection that had to be sent back, and it had to, I don't know if it had to have surgery or not, but pretty intense. And I don't think this mother realized that there was Pseudomonas and other issues on the unit. But again, it was supposed to be this part of this Baby Appeal fundraising thing, or Baby Grow Appeal fundraiser. And they use that mom too, which I think is sad. That baby suffered, and there was no reason for that baby to have been septic. This is the part where we see Lucy with her holding up, a baby, holding up an outfit of the baby and stuff, and she was the face of this appeal, probably because she was just personable, pretty, and there was speculation, and I have to agree that there was probably a little group of chunk of nurses, it's on every unit, that would resent this, would say, well, why is she doing it? Why can't me? I'm probably more experienced than her, whatever. Again, you get a group of, I hate to say this, and I'm ashamed to say this as a woman, but if you get a group of women together, there are some that never mature past their teenage years, and they could be rather, shall we say, mean girl. So there is a group of mean girl nurses on this unit. It's not all of them, and it's certainly not the group that Lucy hangs out with. But again, they are playing a part in this situation. It's not only Brewery and Jerram, it is the trainee doctors that are a part of this. I gave a video yesterday about a certain trainee that was pretty awful. And also there is other multi-factors in on this too. It probably involves, they needed her convicted to protect, the neonatal transport system was having problems. Liverpool Women's Hospital was having problems. And we needed to protect certain powerful consultants and agencies, and I guess the NHS. And just an FYI, I am in no way trying to downgrade the NHS, downgrade whatever your system is over there in the United Kingdom. We have our share, and I have worked at our share of Countess of Chester hospitals. We have our systems that are just awful, and we have just as much corruption as you do, although it sometimes comes in a little bit of a different flavor, as into insurance companies and whatnot, and pharmaceutical companies too. So, okay, so they're reaching that. Now, I'm reading my notes here, so I do apologize if I do take a break here. What happens is, it looks like in June, and Baby A's mom, again, I'm going to be giving you the reason, and this is only part one, the reason why this all started with Baby A, and think cover up. And it's always the cover up that gets you. It is not the action of what you do, it is how you cover it up is the problem. So she comes in, apparently she was, I'm not sure how old she was, but she's got a history of what they call antiphospholipid syndrome, which is basically a condition where you are a high risk for having blood clots. And this poor woman at the age of 22 probably had a blood clot that went to her brain, and she has a history of a stroke, and that is a stroke at 22. Can you imagine that? We have now, I'm not saying we, when I say we, I mean the wonderful group of people that are in the social media that are doing some incredible investigative work have found out that she also had lupus. Now, miraculously, and it's amazing that she was even able to even conceive and carry a child, let alone carry twins. Antiphospholipid syndrome, you have a high chance of having a miscarriage. So it's a miracle pregnancy to begin with. It looks like she has experts in London, probably for her lupus and her antiphospholipid syndrome. I'm assuming she lived in the Chester area, and by all accounts, she had an incredible plan of care for delivery. The plan was for her to actually go to London to deliver, so she could be close not only to her experts, but to also that the babies would be close to the Great Ormond Street Hospital, which my understanding is your best hospital in all of the United Kingdom, and I understand it ranks among the world's great too. So unfortunately, I think she was like 2 or 1 weeks away from actually moving there and anticipating the delivery. She is now at around 30 to 31 weeks of gestation, and by all accounts, it looks like her blood pressure is shooting up, which is bad sign. It could be a sign, two reasons it's a bad sign. It would put her at higher risk for having yet another stroke. And secondly, it could put her into certain conditions, such as like a preeclamptic condition, which then leads into some very, very fatal situations that could happen during and right after the delivery. They do not tell us whether or not she went into a preeclamptic situation. We do know that she went in, she had a high blood pressure, and that is just like signs. She enters the Countess of Chester Hospital as she should. She is told that she is too unstable for them to transfer her to a level 3 unit, which would have been either Arrow Park, and my guessing it probably should have been Liverpool Women's Hospital. Now, she enters the hospital, it's either a Friday or a Saturday, which is not good. Brewery is notified, and the reason we know that is that he had sent trainee doctors, as he should, to go over and speak to the mom concerning what we believe would happen. Her birth would probably happen there, and just as a way to introduce themselves, a way to just express to the mother, you know, what should you anticipate so far as like what a premature baby would look like and what their plan of care is, and also to kind of let her anticipate that we are going to be watching out for certain situations that would correlate to whatever her conditions were during her pregnancy. Another good thing is that they're going to be able to assess this mother. They're going to be able to tell her, kind of understand what her educational level is, her understanding of things, and just to kind of get a good eyes on the situation to see if maybe down the road if the mother would benefit from any social services, or the babies too. But more importantly, to reassure the mom that we're on this, okay? There's a good neonatal team. Now, Brewery had to have been notified of this mother's history by the obstetrics team. And he failed to tell his trainees when he went to tell them. Now, I'm assuming he assumed, as of course he would assume, that they would have looked at the mother's history. By all appearances, they didn't. And that is beyond inexcusable. They knew they needed to look at the history. They didn't. I did enough chart auditing on my maternity ward to know I would see this all the time. The neonatologist would kind of come in and talk to the mom and do all that important stuff, but they would document in the chart that they did that too. So by all accounts, no one's aware of what's going on, and we're now headed toward or into a weakened situation. It looks like the mom is getting worse. Her lab values, we don't know what those are, but they are getting worse, and it's a seer sign to me that she is possibly going into eclampsia. She may even be preeclamptic, and she could have even been headed towards something what we would call HELP syndrome. And I will not describe that to you. That is an absolute horror show, the worst outcome you can ever imagine. It is Sunday night or Sunday evening, somewhere around 8 o'clock in the evening. They need to do an emergency C-section on her. So emergency that they have to put her under something called a general anesthesia. And that means we got to get these babies out now. The father isn't even allowed to be in the delivery room at that time. Usually you have the mother awake, you have her an epidural kind of a situation, and when you're doing a cesarean section. Now her blood pressure is so sky high, again, we are worried that she's going to have another stroke. They're pouring in magnesium, and that is a way to hopefully lower that blood pressure. The problem is that is also what they call, has a neurological effect. It's going to kind of bring down your neurological, it's going to make you sleepy, lethargic. Just an FYI, I had to have magnesium myself during, right prior to a delivery, because I had a problem delivery, and that was used on me, so I know what it's like. You can't even lift your head up. You can't even get out of bed. You are so out of it. So another problem is that there's not enough staff to receive that baby. on the neonatal side. All we have is a first year and a third year trainee, and somehow they're only able to get one nurse. They needed more than one nurse in this situation. So just another something for you to take note here is when a mother is pregnant with multiple babies, they will number the babies during that pregnancy. And how they number the baby is they're going to give baby number one. The one that's closest to the cervix will get number one, and number two, number three, kind of a situation is how they number it. And that's why they can monitor those babies during the pregnancy. They know, okay, baby number one is going to be like this, baby number two, we can anticipate this, and baby number three is going to anticipate this. Take that note, because Brewery is going to use that to his advantage later on when he writes reports, because he's going to have to hide a lot of situation on this. Mom is delivering. Again, you don't have enough people at the delivery to accept this baby. But anyhow, what they do is they deliver. Well, in utero was baby number two, but this is baby A, ends up being our baby A that we know about. That baby's delivered. Then they deliver what was baby number one in utero is now baby number two. So again, there's going to be some twin swapping going in on that. Okay, so baby A comes out, and again, these registers don't know that mom has something called lupus, and that would put the babies, and that is a known thing, at high risk of having cardiac arrhythmias. Kind of a situation going, maybe it might not be that the signal in the heart might not be working correctly, or it can start off, and then the heart has its own pacemaker, per se. It's like you have your own pacemaker, but what happens is that signal is not following down in order to do it. It's at high risk of having a heart block and other arrhythmias. It's also at high risk because of the mom's antiphospholipid syndrome of having strokes. They're unaware. But either way, the baby A, which was twin 2 in utero, comes out, and it is absolutely limp. It doesn't have a heartbeat. It is floppy. It is blue. It is whatever. That third year trainee correctly grabs that baby and that nurse too, and they start the resuscitation on that baby. All right? And they start giving it air, and they start giving it air, and they start giving, start at a lower pressure sometimes, just because this is a premature baby. They want to protect those delicate airways, that delicate tissue, and not blow something out. It's not responding, okay? They up the pressure on it, as they should. All of a sudden now the baby gets a heartbeat, but it's bradycardic, all right? It's a slow heartbeat. And eventually the baby does improve enough, which is good. Now, we don't know, was this baby, and again, with a child, you always know that it's the respirations first and then the heartbeat. In an adult, usually you have a heart attack, your heart stops, and then your respiration stops. It's the other way around in a child. So we don't know, was the heart not working because the baby was not breathing? Was the heart not working because the baby was so stressed in utero, and it maybe had an underlying cardiac condition that's the reason the heart. Again, we don't know, because Brewery was able to do things to make sure that this was not investigated. It had to be hidden. Okay, they're doing everything they can. They get that baby, again, getting that baby to the point that it's looking much better. In the meantime, what was going on here, that second baby, baby B, which was baby 1 in utero, is delivered and handed, and all we have is a first year. Okay, oh my God. It's poor first year. And it doesn't know, it's doing the correct thing at first, giving it a lower breath, but the trainee hasn't had enough training and doesn't have someone maybe alongside them with more experience to kind of coach them through this as they should have, maybe a consultant, to ump that. And so it's a bad situation. That third year cannot go, and that nurse cannot help that first year training. They're still resuscitating baby A. So a crash call is put out for the consultant to come running. And that consultant was Murphy Salati. He doesn't show up, even though he testified at Thurwell he was at the delivery. But again, that's again for someone to see if there is a perjury situation. Luckily, there was another register that was able to show up, and the baby was resuscitated. Again, these trainees, and they get the babies in relatively quickly to the neonatal unit. And again, they're thinking that, okay, this is just a situation. The reason these babies came out kind of not so wonderful is that my mom had a general anesthesia, which would have passed on to the baby and making them just as anesthetized as the mom. The mom had magnesium. It would have made the babies just as kind of lethargic as the mom probably was on her magnesium. And in any type of situation, in any cesarean section, and especially one that's an emergency, the lungs would still be full of all that amniotic fluid. So they're thinking it was just a case of a situation where we just kind of needed to get that baby going. Sometimes you gotta jump start with some rescue breaths and stuff like that. And once you get that going, and once you kind of, come on, baby, you can do this. We're gonna give you a little start here. And once you do that, a lot of times the babies are okay. Again, they just don't know the history of these babies. They don't know the history of the mom. They didn't do their homework. They didn't do their homework as trainee doctors as they should have. They also did not Brewery didn't notify them too. So here it is, 8:15, I don't know, in the evening, and they're bringing those babies into the neonatal intensive care unit. And again, they're not thinking the babies are as high as high risk as we now know that they were. And what they should have done is say, okay, grab a nurse. Okay, this is a situation going on here. We got a mom here. We got a 31 weekers, twins, mom with history of APS. We got to watch out for clots. Mom's history of lupus. We got to watch out for cardiac. Get the 12 lead EKG in here now. Do we have any pacing wires? We may need pacing wires too. Pacing wires is something that would you would need to jumpstart the heart. And again, I don't know what was the supplies at the Countess of Chester, and also since no one. Essentially, the obstetrics, they're not communicating with neonatology or I guess obstetrics assume neonatology would do the right thing and, know mom's history. Or at least read whatever the obstetric history was and would know to have that 12 EKG capability or those pacing wires capability in the neonatal intensive unit, just in case this mother would deliver within 24 to 48 hours, or at least notify Liverpool and say, okay, you're on call right now. We got a situation here. We don't have the cardiac capability. Are you available? Or, be on standby. Another kind of backstory here is that at this time in Liverpool, and again, I kind of told you about our friend Dr. Yaxo, who was the head of the neonatal intensive care unit at the time, and a friend of Brewery's. Oh, and by the way, such a good friend of Brewery's that he made sure that when his daughter, who was training as a physician and training as a pediatrician, I think it was in 2018, made sure the Brewery was one of her trainers. She did it at the Countess of Chester. And this was in 2018, long after, Lucy, all the situation had gone on with Lucy. So had real good buddies here, okay? Again, the backstory in Liverpool Women's Hospital at this time, it had severe financial constraints on it. A huge chunk of its budget was just going to pay compensation on basically screw-ups. So it was faced with a real financial situation going on. And I don't know if these screw-ups were in the neonatal department, could have been in the I don't know if it was obstetrics. It could have even been in the gynecological situation. They are dealing with women that need hysterectomies and various gynecological cancers. So again, I don't know where these payouts were going to, but it was a good chunk of their budget. Also, Liverpool Women's Hospital had a fertility clinic. And the goal for any fertility clinic is that you want to have as many singleton pregnancies versus multiple pregnancies for obvious reasons. You're going to have the outcomes are much poorer for babies that are multiples versus that. So, and they tried to get it to a 10% goal, which is a very worthy goal to do it, but how we believe they were able to achieve that is that maybe they were having brewery take on multiples for them, so they didn't have the multiple deliveries. Again, Yoxel is such a good friend of breweries. I have no proof of that, but it sounds like that could have been a very important situation. Now, again, when you're bringing in these two babies in, the nurses, we don't have, although we should know the history, but sometimes when you're in an emergency kind of a situation and you got to new admit, it is up to those doctors to just basically say, hey, I've got 30 weekers here. Again, I've got, let's get what do we got? We're going to need 12 lead EKG and stuff like that. And I can guarantee the nurses have, and I'll give you an example of what I would have done as an adult, a nurse way back when I dealt with trainees, and I had wonderful trainees. I had wonderful trainees I work with. They weren't perfect, but rarely had a problem. If one of the trainees would have grabbed me and said, okay, we got a hot loop coming. And what that means is that's just code for we got a leukemic that's going to arrive on the floor soon, and that's septic. And I know exactly what I would need to have on that floor. I know what I needed to, even before the doctor would have wrote that orders, I knew exactly what he was going to write. So I would alert, pharmacy, make sure my antibiotics are here. I'm going to call radiology to make sure I'm going to need a stat portable chest x-ray. I'm going to have my urine bottle there. I know they're going to need a urine. I know what bloods are going to need to be done and everything. And I'm just going to basically yell out to him. I'm not going to say, do you need? I'm going to say, urine EKG, this. And he's going to say, yes. So technically, he's the one that's supposed to give me orders, but since I know what the orders are coming, I'm just asking him just to make sure that trainee's got so much information he's dealing with, and he's dealing not only with that patient, but he's dealing with 10, 15, 20 other patients that, again, having this as a backup, having this as a nurse, making sure that everything is done. And I would even get to the point where he would order me, I knew what bloods that needed to be done, and he would tell me, draw this, and this blood. And if I knew that, well, he didn't ask for that blood, I'd draw an extra vial and come back up to him and say, I forgot to order type and screen, meaning because I knew if it was a leukemic, they definitely would need blood transfusions. And he invariably would say, oh, thank you, yes, kind of a situation. I would make sure they would have all the lumbar puncture tray available just in case they would need it, because often leukemics, they're so immunosuppressed, there's a good chance they would probably need a meningitis. And all he'd have to do is just look at me, LP, and before I just hand it to him, again, and that's how it works together. What I think is that Lucy was this type of nurse, and probably saying things to him, this, and this. And instead of acting like the trainee doctors who was grateful that a nurse was their backup and knew that if they forgot something, because they're human, they're under pressure, they're working immense hours. There's more pressure on them than there is on me, that they had a nurse as a back. They were taking this as, I got a feeling they were taking this to their, how dare you question me or anything like that. So again, my understanding is the rumors of her being a killer nurse, it started with the trainee doctors. Again, and then apparently it spread to Brewery and Durham. I don't know. So I'm going to leave it with that. Unfortunately, again, these doctors had to ensure that they had at least the nurses aware, so we would make sure that we would have an adequately trained nurse, and that those babies that patient was in a high enough level. Meaning, I got a feeling it was, or even though it may have gone into room 1, there's still levels of intensive care. So there's high intensive care, and again, if they would have said cardiac, blood clots, we would have known it would have been the highest of the highest, and we would have ensured it would have been a 1-to-1 situation with those babies as it should have. Instead, what ended up doing, and they were thinking it was just, okay, 30 weeker, that wasn't so bad, that they gave the nurse that received this was a very inexperienced nurse. And not only did she have one, but she had two, which is uncalled for. And she wouldn't, because of all the things that they need to do, connect all these babies to all the monitors, get them in the incubators, get them settled, make sure that they are warm, and everything that a nurse needs to do, she would not have that time to go back and investigate the history. This is where the trainee doctors and Brewery messed up. Also, Dr. Salati messed up too because he did not show up as he should have. Now, what we are finding out now and what we are anticipating, again, I told you about that baby grow appeal. Brewery immediately, as soon as that baby A died, had to go into cover-up mode. And how he does it, he does a little bit of a, what did they say, the twins swap on that, he has to make out various reports and go through various committees and meetings and stuff like that, but he's doing a very good job of hiding and doing a cover-up. I think he was better than over here in America when it came to Watergate. He did even more on that. And it's not looking good. And I will, again, this is just the tip of the iceberg. When I give you the other stories on this, it's going to get worse. It's going to get worse, and it's going to get sad, and it's not looking good. And then I will let you know when our friend Ravi Jairam comes in. Again, there is Brewery, Salati, and Ravi screwed up on this, and by all appearances, they damn well knew that baby appeal. They reached 1.5 million pounds at that time. That mom, those parents, if this would have gone into a legal situation where they needed to be compensated, that would have been wiped out. They would have not had that new building, and it would have cost them more than that 1.5 million. So I'm going to leave it at that. Bye-bye.